Combining checkpoint inhibitors might have quite a bit of value, especially because, as we all know, the immune system does not function in only one way, but it has different steps along the way. And as such, a anti-CTLA-4 that can block the immune system, part of the lymph node activity that will translate to further activation of the blockade in the tumor itself, which will be anti-PD-1, is a totally appropriate combination of therapy. Combining checkpoint inhibitors, as I stated before, is a very important aspect of the treatment for primary liver cancer, HCC. And if anything, the argument that a anti-CTLA-4 that will activate the effect of the immune system onto the lymph nodes and then will activate further the effect of the immune system onto the tumor itself is a very reasonable approach. And for that reason, a currently large clinical trial, which actually will be the largest ever clinical trial in regard to primary liver cancer, with close to about 1,300 patients, will be looking into the anti-CTLA-4 tremelimumab versus anti-PD-1 in regard to durvalumab, compared to the combination of the two being durvalumab plus tremelimumab, and of course with the comparison to the standard of care currently for first line, which is sorafenib. Checkpoint inhibitors have been really driving a lot, not necessarily all, but a lot of the data and efforts in regard to research in regard to primary liver cancer, HCC. On the other hand, everybody is trying to find out what could be a good combination of a checkpoint inhibitors with a certain TKI. And if anything, there are certain different arguments in that regard, and among which, for example, and this is only for example based because there are too many of them, but for example, c-Met inhibition plus checkpoint inhibitor could be very a reasonable approach to consider based on some preclinical data in that regard. The future of clinical trials in regard to checkpoint inhibitors is rather very promising. And if anything, I put a lot of faith in this large and important study in the first-line setting for the combination of the durvalumab plus tremelimumab versus durvalumab versus tremelimumab versus sorafenib as well. This is, of course, will come along the same time by the time where the nivolumab versus sorafenib study has already completed accrual, and of course we're looking forward for its results. However, short of looking as the checkpoint inhibitors from the standpoint of systemic therapy for advanced disease, we should not ignore the potential use in regard to locally advanced disease. And if anything, as I stated many years ago, almost 10 years ago in one of the reports in JCO, that the combination between local therapy and systemic therapy is not a divorce, it's a marriage. And if anything, the combination of a embolization or a combination of yttrium-90 plus a checkpoint inhibitors is definitely underway, and there's definitely evident clinical trial that we're looking forward to see about the results of.